Hello, my name is Jaung. I'm working for the Department of Nursing at Jaung University. I start presentation. The title of this paper is A Study on the Relationship Between Major Satisfaction and Career Identity of Nursing College Students. The following is the neat introduction. The occupational environment in the modern society of biotechnology has changed in various aspects compared to the past occupational environment. In this changing environment, we need to constantly develop to cope with future jobs properly. Humans should develop the ability to actively cope with social development and changes in the occupational world in a rapidly changing environment. As one of the many factors that lead to organizational turnover of new nursing students are not sufficiently concerned about their career and preparing for their career. The career identity of nursing college students is not established, so self-confidence in nursing profession is insufficient. Career decision-making efficacy refers to the degree to which the best decision can be made in course of career selection, which affect career identity and future career perspective formation. In the research of Che, career decision-making self-efficacy was the most influential factor in career identity compared to career decision level, career decision-making type, and career preparation behavior. Career identity is a self-identity related to the occupational area, which means a clear and stable image of an individual's goals, interests, and talent. It is related to self-confidence in making appropriate decisions in the face of inevitable and ambiguous environmental situation in relation to reasonable decision-making. Therefore, it is necessary to identify factors that affect career identity in order to making health college students identity of their jobs career before graduation. And next, the following is a research purpose. The purpose of this study is to provide basic data for systematic guidance and education for establishing identifying the relationship between major satisfaction and career identity of students in the Department of Health and Welfare, and by clarifying the relationship between major satisfaction and career identity. The specific purpose of this study is as follows. First, the major satisfaction and career identity of the subject are identified. And second, the major satisfaction and career identity according to the general characteristics of the subject are identified. And third, the relationship between the major satisfaction and career identity of the subject is examined. The following is research design. The study of a descriptive research to understand the career identity of the students of the Department of Health and Welfare who are attending J University in Chungcheong area around and to understand the relevance. Next, following the sampling method of subject. The subject of this study are 250 students attending nursing, physical therapy, and health administration department attending J University. The data collection of this study were conducted from September 1, 2019 to September 30, 2019. The number of subjects in this study were calculated by G-Power 3.1 software to calculate the appropriate number of samples. The minimum sample size required was 189 when the difference between groups was verified by significance level, power 0.95, effect size 0.15. The questionnaire was distributed and collected to 250 people by convenience sampling considering the dropout rate of the researcher. Of the collected questionnaire, 2,040 people were selected as the subject except for 10 people who were insufficient in response. And following is a research tool. First, general characteristics. The general characteristics of subject were composed of 9 characteristics such as major, gender, grade, academic record, satisfaction of major, clinical practice experience, and health status, interpersonal relationship, degree of economic life. And second research tools is following. Major satisfaction. The major satisfaction tool used by Lee and selected as the major satisfaction related item among 34 items of departmental satisfaction tool written by Kim and Ha. The major and satisfaction were divided into 5 sub-satisfaction factors and measured specifically by selecting 7 general satisfaction factors and 5 cognitive satisfaction factors. The remaining questions except school satisfaction were modified and supplemented to suit the purpose of the researcher. The major and satisfaction were divided into 5 sub-satisfaction factors were specifically measured. In this study, the questions asking about the satisfaction of major were 26 questions and were divided into 5 items: general satisfaction, curriculum satisfaction, relationship satisfaction, awareness satisfaction, and career satisfaction. The internal consistency of 34 questions of department satisfaction questionnaire and also reliability and the Cronbach pass coefficient was 0.92. The reliability of each factors was highest with general satisfaction, awareness satisfaction 0.89, school satisfaction 0.87, relationship satisfaction 0.76, and curriculum satisfaction 0.73. The following is a tool career identity. In this study, 18 questions of the identity scale, which is the sub-scale of my vocational situation, developed by Holland, Diazor, and FoCoS were translated by Kim and Kim to suit in the Korean situation, and 40 questions were used by Kwon and Kim to be modified and supplemented to suit Korean nursing college students. The tool is 4 point, 3 point, 2 point, 1 point, not error, right 4 point, which means that the higher the score, the higher the carrier identity. In the study of Kwon and Kim, the reliability of tool was Cronbach's alpha 0.88 and the reliability of this study Cronbach plus 0.86. The following is data collection method. After the researcher visited the lecture room with the prior cooperation of the nursing department of the research subject, fully explained the purpose of the study, questionnaire and how to write the consent form, and distributed and wrote the questionnaire and collected it immediately. In carrying out of this study, consent was received for ethical protection of the subject. The consent was given to the purpose and contents of the study, the period of participation in the study, the autonomy and anonymity of participation in the study, the fact that the participation can be stopped at any time during the questionnaire response, and the disadvantage caused by the suspension of participation. And next, the following is data analysis method. The collected data were analyzed using SPSS Win21 program. The analysis method is as follows. The general characteristic, major satisfaction, and carrier identity of subject were analyzed using frequency and percentage. The relationship between major satisfaction and carrier identity, according to the general characteristic of the subject, were analyzed by t-test, ANOVA, and self-post hoc test. Pearson correlation analysis was used to analyze the relationship between the major satisfaction and carrier identity of the subject. And next, the following is conclusion. The general characteristic of the subject of this study is as follows. The students in nursing, physiotherapy, and health administration were 177 women and 63 men. The survey was conducted with 93 students in the second grade and 145 students in the third grade. The major satisfaction of the highest with 116. The response, the presence of clinical practices experience was 114 patients and yes, and 126 patients with no. The most common interpersonal relationship was gardeners with 130 people, economic life with 140 people, and there was a reason with 51 people. Next, the following is table 1. And next, the difference in major satisfaction according to general characteristics of nursing, physical therapy, and health administration students is shown in table 2. As a result of analyzing the difference of major satisfaction according to the general case test, there was a statistically significant difference in department, grade, major satisfaction, health status, and interpersonal relationship. The department of showed higher average and standard deviation in physical therapy than nursing and than health administration departments. The highest score in post-test was higher than the middle high score. The major satisfaction were very satisfied, very dissatisfied, and dissatisfied in the post-test. The following is Table 2. Difference in career identity according to the general characteristics of the subject are as Table 3. As a result of analyzing the difference in career identity according to general characteristics, there was a statistically significant preference in departmental, grade, major satisfaction, health status, interpersonal relationship, and economic life. In the post-test, the Department of Health Nursing and Administration was higher than the Department of Physical Therapy. The score of the middle and lower rank was higher than the upper, middle, and lower rank. The satisfaction of level of major was higher than the satisfaction level of the post-test. Health status was higher in goodness, badness than in goodness, normalness, and very badness. The mean and standard deviation were higher in interpersonal relationship than in normal relationship. The economic life level was insufficient in the post-test, living normally and living difficult in order. There was no statistically significant difference in gender, grade, and clinical practice experience. The following is Table 3. As a result of analyzing the correlation between career satisfaction and career identity of the subject, there was a negative correlation. And next is discussion. This study was conducted to provide basic data for systematic guidance and education for establishing identity of a firm career by identifying the relationship between major satisfaction and career identity of health coexistence and clarifying the relationship between major satisfaction and career identity. As a result of analyzing the difference of major satisfaction according to general characteristics, there was a statistically significant difference in department, grade, major satisfaction, health status in the interpersonal relationship. These results were similar to those of Jaung in the study, which showed significant difference in major satisfaction according to general characteristics, according to grade, school grade, clinical practice experience, clinical practice satisfaction, and motivation for going to school. There was no statistically significant difference in gender, grade, clinical practice experience, and economic life. In Jaung's research, there was a significant difference in the experience of grade and clinical practice, but there was no significant difference in this study because there were 140 patients who had clinical practice experience and 121 people who had no clinical practice experience. We propose a repeated study to see difference according to the presence or absence of future hands-on experience. And next, the following is conclusion and suggestion. The relationship between major satisfaction and career identity of the subject was found to be negative. The department of that perform clinical practice first experience the role of job through the curriculum and worry about whether it meets their aptitude. Therefore, it is considered that improving the adaptation to the major by grasping the attitude, interest, and problem of each individual student in the early stage of admission through regularly meeting with the professor and senior can have a positive effect of career identity in the future. In addition, this study aimed to improve the quality of the department by improving the self-esteem of the students by finding and supplementing the method to increase the satisfaction of the students in the department, and to use them to improve the satisfaction of the students by accurately graphing what the students consider before entering the department and what they are affected by. This study showed that there was a correlation between the hypothesis that major satisfaction will have a negative effect on career identity. However, future studies are needed to prove the causal relationship between those two variables, and further studies are needed to prove the causal relationship between the hypotheses based on this study. Since the sample was extracted from one school, there is a limitation in the representativeness, so further research is needed. Thank you. I'm going to finish my presentation. Thank you for my listening.